let us go to differential diagnosis. The topic is constipation, looking at it in a Western and CM difference. So for Western differentiation, let's look at number one, the common causes, which is low fiber diet, poor bowel habits, lack of exercise, sedentary lifestyle, not drinking enough, stress, travel, and medications. Number two is mental emotional. One could be irritable bowel syndrome, which is constipation alternating with diarrhea, abdominal pain, distension, flatulence, and emotional distress. And then the next one is depression. This is constipation with fatigue, sleeping problems, change in appetite, sadness and depression, poor concentration, inactivity, and withdrawal. And it could also be due to anorexia nervosa, which is constipation with dramatic weight loss, muscle atrophy, loss of fatty tissue, amenorrhea, low blood pressure, tooth decay, yellowing of skin, and depression. And there's also anxiety or embarrassment. And the number three is endocrine. When there is hypothyroidism, the constipation will be with weakness, fatigue, cold intolerance, weight gain, depression, joint or muscle pain, brittle hair, and fingernails. Number four is tumors and growth. So there's colorectal cancer, where there will be blood in the stools, anemia, abdominal pain, intestinal obstruction, and weight loss. There's also tumors of structures outside the colon, where there's pressure exerted on the colon. And then there's number five, which is the megacolon. One is the Hirschsprung's disease, which is a congenital disease where there's delay passing the first stool after birth, vomiting, and poor weight gain. And for the next one is the acquired megacolon, which is a complication of ulcerative colitis. Number six is anal lesions. Number one is A is fissure, where there's blood on surface of stool, pain on bowel movement, and cracked anal skin. And next is thrombosed hemorrhoid, where there is anal itching, anal pain, and bright blood in the stools. The next one is diverticulitis, where there's pain in the left lower abdomen and rectal bleeding. For the Chinese differentiation, number one is organ interrelationships, where lung and the large intestine is internal and external pairing. Stomach and large intestine is a Yang Ming and Sheng cycle. Metal and water, which is the Sheng cycle. Heart and large intestine and liver is the Ke cycle. Number two, the nature of constipation. Where dry stool is heat or yin or blood deficiency. If it's pebble-like stools, there's heat, liver, qi stagnation. If it's very dark or brown or black stools, that is heat. Neither dry nor hard is qi or yang deficiency or qi stagnation. Moist with mucus is phlegm. Long thin stools is spleen qi deficiency. Abdominal pain and distension is stagnation of liver qi. Severe spastic pain is cold and toxic heat. Exhaustion after bowel movement is qi or yang deficiency. Number three is the most involved organs, like stomach, where it's the origin of the fluids. And then the large intestine is the eliminator of waste. The spleen is the transportation of stools. Liver is smooth flow of qi. Kidneys controls two lower orifices. And number four is etiology for constipation is poor diet, which if you eat a lot of spicy food, cold food, lack of fiber, or there's food poisoning. Emotional stress like anger, resentment, and frustration and worry can also cause constipation. Lack of exercise, overwork and childbirth, febrile disease, which is an external pathogen progressing to the interior. For the Zhangfu organs, that we will look at the excess and the deficiency. For excess, heat in large intestine or stomach, stomach fire, food stagnation in stomach, stagnation of liver qi, liver fire blazing, fire toxin in Yang Ming. And for the deficiency, it's spleen qi deficiency, stomach yin deficiency with empty heat, kidney yin deficiency, and kidney yang deficiency. Thank you so much for your attention.